Close to a year after the country recorded its first case of the novel coronavirus, which have since turned the entire country and the world upside down, the country is still reeling from the effects of the virus, which have brought about the loss of lives and livelihoods and thrown the country's economy in a spin. And as the government tries to take stock of the impacts of the pandemic by giving daily briefings on new infections and death toll,
tunaona kwamba watu wengi wamekufa manyumbani. And inakaa hatujui sasa kwa wakati huu ni watu wa kiasi gani ambao wamekufa na wamekufa kutokana na nini.
It is now emerging that the death toll by the Ministry of Health could be way lower than the reality on the ground.
Like last year, that is where we were at that 9.9%.
According to the Civil Registration Service, only 39% of deaths were reported in 2020 when the country was hardest hit by the pandemic.
Vile vifo tunapata ni vile tumepewa report na sana zinatoka kwa facilities, kwa health facilities, hospitali. Na sasa kama mtu pengine alipata ugonjwa na amekufa nyumbani na hatupewi hiyo report, hatuwezi jua.
Dr. Soti says the missed out numbers could be as a result of the low numbers of patients who visited hospitals in 2020 due to the crisis caused by the pandemic.
Kianza mwaka jana wakati wa COVID kianza, hatukuwa na wananchi wengi wakija hospitali, watu walikuwa naogopa.
This posing serious questions on how far the virus has spread without being detected, further compounded by the low levels of testing by the Ministry of Health.
The problem is not even with the civil registration, the problem with the Kenyans themselves.
And as a save-face move, the government have since launched a rapid mortality rate survey in 6 pilot counties to establish the real number of deaths caused by the virus.
So tukifanya hiyo utafiti ambao tunataka kufanya, itatupatia fursa ya kujua kama ni watu ngapi wamekufa, pengine wamekufa zaidi kuliko ile miaka iliyopita, na ni COVID au ni ugonjwa aina gani inasababisha hivi vitu.
The exercise will be held down to the grassroots level and will include chiefs and other members of provincial administration who have been keen in recording the deaths at the grassroots level.
The WHO is supporting the process both financially and technically, and we are out to support this in the whole country.